Hello and welcome to AIDS 2024 Day in Review, brought to you by Plus Life and Gilead Sciences. I'm Carl Schmidt. Can you believe it? It is day 4 of the conference already. And if the last 24 hours are anything to go by, we can still expect much more to come before AIDS 2024 comes to a close tomorrow. Now, I'll have some highlights from the last 24 hours for you in just a moment, but you'll want to stick around because coming up later, I will be joined by Senior Vice President of Clinical Development from Gilead Sciences, Jared Baton, along with Mitchell Warren, the Executive Director of Advocacy, Access and Equity, and Polokeng Mololai from Mothers to Mothers to talk about looking ahead, the HIV of tomorrow. I've also got an exclusive one-on-one conversation with Derek Spencer from Gilead Sciences about improving screening and linkage to care through partnerships. So as you can see, it's a busy and action-packed show. So let's get things started by taking a look at highlights from the past 24 hours.
Because if you have a population that is increasingly sexually healthy and active, we really have to figure out how we're going to figure out the STI portion.
The future of HIV science was front and center yesterday in a special session attended by 3 renowned scientists.
504 were diagnosed with HIV, and 92 were classified as having recently acquired HIV.
What does HIV advocacy look like in the digital age? Influencers shared their views on the power of social media.
Being able to have interviews with experts and translate that for community is immensely powerful.
As you said, language really matters. You don't want to isolate or alienate anyone.
Jared, good to see you.
Great to be here, thank you.
Let's get right into it, because you're a busy person, you've been pulled all over this conference, and I appreciate you having the time to do this with us. From your perspective, how do you assure HIV clinical research is designed so that the people most impacted by the outcomes are centered to the whole process?
No, there's no point in doing work that doesn't end up connecting with the communities who are most at need. You have to, from the moment you are thinking about clinical research, before there's a word on a page, it is engagement with communities so that the answers that you generate one day will be relevant. Will be able to change people's real lives.
Right.
Yeah.
Putting people first.
Putting people first.
We've been saying it all week. How have you seen community engagement present in the clinical work here at AIDS 2024? And what's the impact of the research presented here at the conference?
There's nothing like this kind of meeting to illustrate the interplay of good clinical research and good community advocacy. We do this work because we want it to have impact. And no matter how great a clinical trial is, no how great a presentation is on stage or in some published paper, none of that makes any difference unless it leads into impact and delivery in people's lives. The only way you get there is community engagement from the get-go. We've seen some tremendous work this week where trials are more successful. Trials have immediate resonance with the world because they were designed with community at the table from the very beginning.
Thank you. That was a really interesting conversation. And here to join the conversation now is Mitchell Warren, Executive Director of AVAC, and Polokeng Mololai from Mothers to Mothers to talk about looking ahead, the HIV of tomorrow. Thank you all very much for being here. I'm going to start with you, Polokeng. What do you believe is the advantage of having women living with HIV employed as community health workers?
Wow, that one is very critical because hiring women living with HIV as community health workers is an investment because these people, they are coming from the same communities. They understand the challenges at communities. So if you put them at a driving wheel, they will learn. They will also empower others because they understand the barriers, the challenges. Furthermore, if you are employing them, you give them that passion to say, I can do it because now I am employed. And then they are the living experiences because they have gone through the journey. Furthermore, they are also the people that people can trust because they are from the same communities.
Yeah, I was going to say, do you find that you get that connection much quicker because you have that in common?
Definitely, yes.
Yeah. HIV treatment and prevention obviously is at the epicenter of the efforts to end HIV. What does the future look like for HIV treatment and prevention in your eyes?
So I really think we are at a tremendous point in HIV. When you look back 40 years and how far we have come and how innovation, advocacy, more advocacy, community, government, policy, all working together got us to where we are. And I think we're at a place now where we really can be looking ahead to ending the HIV epidemic and ending it everywhere.
You really believe that?
I really do believe that. I believe that it is, although I'm running around all week, it is so energizing to be here, and to be here in a week that is so full of positive energy, because it's a week where I think people will look back on this and say, this is the week that we really believed that we could end the epidemic all around the world. The future is about taking the tools we have and building new tools.
Right.
Particularly things that fit really into people's lives in both treatment and prevention, so that everyone gets to treatment or prevention option that's going to really work for them. We put that all together with the advocacy will, with the great science, with the community engagement, with the political will. We put it all together, and that's what gets us to the end.
Collaboration is key.
Oh, so much.
Yeah.
It is partnerships upon partnerships upon partnerships.
Mitchell, for you, how is AVAC accelerating ethical development and equitable delivery, of effective HIV prevention options?
It actually goes exactly back to the theme of the conference, putting people first. And it's what we've been saying in HIV for even longer than a conference, and that is nothing for us without us. And that's true of developing products, and it's got to be true of delivering products, because as important as clinical trials are, clinical trials don't prevent infections unless you're in the study, and they certainly don't end epidemics. So you've really got to center community. And we've been working around this for decades, particularly when I think now of antiretroviral-based prevention, PrEP. When you think 20 years ago, some of the trials really struggled because they didn't involve communities. So part of accelerating the science is actually engaging all stakeholders earlier in the process, in the design of not just the trials, even of the design of products, and thinking about it. That's how you accelerate it, and it's how you connect what I call R&D and D, research and development and delivery. If we only do R&D and we don't think about delivery at the beginning, we will fail. It's really connecting all of those dots.
Well, speaking of, those kind of partnerships, how do investigational, person-centric compounds fit into the larger conversation around HIV treatment and prevention, do you think?
For so long, we worked so hard to be able to get medicines, to be able to save people's lives. And what a change. And what a change that was. And then we worked so hard to be able to get prevention options so people could take control of prevention within their own lives. Now we really have to be able to work on options that fit into people's lives so that every person can get to successful treatment or prevention. We have options for treatment and for prevention, and yet there are still 1.3 million new infections that occur around the world every year. There are still millions of people who aren't virally suppressed, who are living with HIV but aren't virally suppressed, and it is not because of them, and it's not because of their virus. It's because we haven't yet built the options that are going to make them able to turn off their virus or bring to prevention that's going to work.
Yeah, and that's sort of on the science side of things. I also think stigma. I say this all the time. I'm like, HIV and AIDS doesn't have to kill you. It doesn't in this day and age, but it's stigma. And that goes from the level of just the personal stuff to the criminalization, to governments, to policy. It all starts there.
It is, stigma poisons all that we try to do in HIV, and how we can use moments like this to think about how to bust through some of the stigma. How we can use energy about talking and normalizing about HIV treatment and prevention and testing to be able to talk about HIV more openly, which sort of breaks down some of the stigma. How we can think about building new innovations like long-acting options for both treatment and prevention that can give people a discrete something that they can use to treat or prevent HIV that is under their control and discreet and private, and so they don't have to encounter the challenges with for many people a daily pill and the stigma of carrying that around.
I think of homelessness, right? People who don't have any. How are you supposed to stay on your treatment if you don't have anywhere to put your treatment?
Exactly. So we got to build the options that fit into people's lives.
Paula King, you've tell me more about the strategy. Health for all brings opportunities for all. How does that work? The strategic partnerships with mother to mother, and how do you get those implemented?
Putting community first, and then we make sure that these people are the ones that are leading the way. It makes healthy people, because the people that are getting the services from the same people that are coming from the same communities, it makes health for all. Because if we look at the approach that we are using for Healthy for All, it's a combination of services, people-centered care, integrated service delivery, because we are not taking diseases in silo, we are integrating them together. So people, when they are having all those, they are all covered, because the people that are giving them the services, they are not only targeting one disease area, they are giving them the comprehensive service delivery. And also to go forward, when you're talking about the partnerships, is very critical.
We were saying that earlier, weren't we, Jared?
Yeah, because the partnerships, it starts even at the lower level, where the local chiefs, we need to partner with them, because they are the ones that are the gatekeepers of what is happening in their communities. The regional levels, national levels, and also to partner also with even the donors. If we are partnering to people that are having the same commitment with us, like Gilead, we are partnering with them now, and we are having best results ever. So partnership is very critical as well.
Yeah, I love it. Mitchell, what have you seen and heard at the conference over the past week that excites you as we look ahead to tomorrow's HIV epidemic?
I don't know that I have ever in my now 30 plus years in this field been more excited about the opportunity, but it also raises both great opportunity but huge challenges, because we have a history in this field of squandering opportunities. And so for me, the issue is, will we seize this one? And history will judge us harshly if we don't deliver, but it is a conference really of opportunity, I would say.
Jared, what do you see as the future of the HIV/AIDS movement beyond 2030 and those targets that have been set?
I want to see a world beyond 2030 where none of us have to have this meeting. It's one meeting 2030 in a little bit, where there's a big celebratory meeting like this, a reunion.
Remember when?
A remember when meeting.
Yeah.
And because I think there's nothing that anybody at this conference would rather do than not work on HIV at all anymore, and that's me included. So if we can get to that, if we can get to a world where we have been able to end the epidemic all around the world, that's where I want to push. Push in prevention, push in treatment, and push in partnership, because that's how we're going to be able to get there together.
Well, Polo King, Mitchell, Jared, thank you so much for this chat. Okay, now that we've had a look at the HIV of the future, I wanted to know more about improving screening and linkage to care through partnerships. And who better than Derek Spencer from Gilead Sciences to tell me all about it? Take a look. Derek Spencer, nice to see you.
Nice to see you also.
Thank you for joining me. I want to talk about improving initial screening, and how does one improve the initial screening and linkage to care services? I know it's a top priority.
Yeah.
What is Gilead doing to advance these kind of efforts?
Yeah, well, obviously you can't get into treatment if you don't find out diagnoses. Yeah. And Gilead has made an incredible commitment, not only on the medical side, but in building infrastructure to make sure that people identify their status. I know earlier you talked to some people who are leading efforts with our Blueprint program, with recommendations on screening and other issues. In 2010, Gilead started the Focus program. And it was a response to the 2006 recommendations that everybody be screened for HIV. We had hit a point in the period in HIV where we believed people could live a normal lifespan. But unfortunately, there was late diagnosis, tons of illness, and people were dying. In the clinic I work in, we hung a sign of who died that week. So to change that, we had to start finding people early. And so Gilead started this program in 2010. It's been a game changer. It's been a game changer.
How so?
Well, the whole mission of the program is to enable partners to develop and then disseminate best practices in bloodborne virus, HIV, HCV, HBV screening, and linkage to care with public health guidelines. And what the program has done, I think most importantly, is normalize, routinize, and destigmatize screening. This is my 25-year anniversary of working in the field of HIV directly. Mm-hmm. And it's been surreal to walk around and hear everyone's talking about stigma.
Yeah.
And while we must address it, we can't wait for it to be over. It's here with us. But we can set up systems that can get above it. And Focus has set up policy-driven opt-out screening in high prevalent areas that makes it normal to be screened. And people are finding out they have HIV from a place of wellness, as opposed to, I'm sick, I lost 100 pounds, or I'm dying.
Yeah. We're so far into this AIDS story. Does it shock you that the
Yep.
stigma is just still as potent as it was at the beginning?
It still feels still as potent. And I love these conferences because we're seeing a lot of advocates who are powerful, who use their voice, but we can never forget that there are portions of this country, portions of this globe, where people can lose their life related to sex, sexuality, how they identify themselves. And so we have to be really sensitive to make sure we're setting up systems that allow them to be diagnosed and allow them to go in care and to be safe. But it's sometimes disheartening, the level of stigma that we're still dealing with.
You know, and I work in media, and I'm asking myself, what am I not doing enough as someone living with HIV that's constantly talking about it? Because it just blows my mind that 40-something years later, we're still across the board. What are public-private partnerships? Why are public-private partnerships important to improving screening and linkage to care, do you think, on a global level?
Listen, we're not going to solve any global health crisis without partnership and collaboration. And so whether it's COVID and Ford Motor Company making ventilators, or whether it's the PEPFAR program, like we have to create a we, us. And so public-private partnership helps us to create scale, synergy, and sustainability. And it creates the we, as opposed to Gilead trying to solve this alone, or you trying to solve this alone, or someone in community. We've got to open our arms, and the solution is in creating that collaboration. I feel strongly about it.
And that's why another reason why conferences like this are so important.
Oh yeah, absolutely. I think we inspire each other, and I think we push each other to next. And quite frankly, we should be honest, sometimes our work can get a little exhausting. I don't say burnt out, but we can get a little crispy. Huh?
Yeah. Oh, I'm feeling cooked.
Okay.
Yeah.
Well, we need people like you when you get crispy or cooked to come to a conference like this or take a rest and then come back and be rejuvenated, because we need you. And the community needs Gilead, and we all need each other.
Good talking to you, sir. Thanks for making the time.
Thank you.
Pleasure. That's all the time we have for today's AIDS 2024 Day in Review. Be sure to tune in tomorrow, the final day of AIDS 2024, to see more amazing, life-changing science that puts people first. I'll be catching up with Davison Gupta from Gilead Sciences to talk about a functional cure through innovation research, and I'll have guests joining me to talk about the progress that's being made towards UNAIDS 2030 goals. Remember, you can like, follow, and share us at Plus Life across all social platforms. We are at Plus Life Media. And be sure to share your thoughts using the hashtag AIDS 2024 Plus Life. From all of us here at AIDS 2024, have a great evening, and we'll see you tomorrow.